Hey there, it's Dr. CAMMISA. Welcome back to our video series. And today, as you can see me, we got a sign of Ultimate Medical Group behind us. And today what I'm going to do, this has been inspired by several patients over the last couple weeks. I'm going to give a tour of the facility, a tour of the clinic that is much needed, but also there's so much stuff that we do here. So stay tuned. If you're new to our channel, click the like button, subscribe to us, share us with your friends, but stay tuned. I got lots to share with this video. As you walk into the office, what you're greeted by is our phenomenal staff here that sit at this gorgeous table here. We have all of our documentation and our state licenses on the side over here. We have a coat rack for the colder months, but now it's going to be 80 today. And now as you come in and get a view of the office, so I'm just going to zoom in into the background there so you can see we have a very open concept. So I'm just going to move through the office and explain the things that we do here. One of the reasons we have this open concept, I'm sitting right now at the front desk, and as you can see, the front desk has a view of the majority of the floor there. And because this is a teamwork effort here, everyone, even though everyone has a specific job to do, it is teamwork that makes this office click. And when we're busy, there is no job description anymore. It's all hands on deck, and everyone is taking care of the patients. This area right here, this is the reception area, or where patients can wait. There's a couple chairs here, and on the wall there, we have two posters. We have a brain map poster on one side for brain mapping all the different symptoms, and on the other side, we have a PRP for the regenerative side that we work with. As we enter the floor here, you can see initially, if I scan quickly, we have lots and lots of equipment here. I'm going to explain everything that we have here. And so as we go back here, right at the beginning here, this first machine here, this is a Centron. A Centron is made by BTE, and a Centron is an eccentric trainer for knee injuries. And right beside it over here, or two over, is a React machine, which is another eccentric machine. Now these are huge pieces of equipment, and so they don't get moved a lot, that's for sure. And then starting here, right in the center, one of our brand new power plates. We just got it, and it's the Pro 7 top of the line unit here. And as I scan around, you'll see we have a sea of power plates. We have one over here in the corner, or one over against the wall where we do posture work. We have a pod of 3 here, a pod of 3 here, a pod of 4 over there in the back, one over here up against the wall for posture rack. And so I have a video on the power plates, the science behind it, why we have so many, and why it's instrumental in everything that we do. All spinal care, all cases, whether it's regenerative, car crash, doesn't matter what it is, everyone is on the power plates to restore their nervous system, their spine, and getting them back to full function so that we can empower them to live their best day every day. And as we look in this direction here, obviously we see another little power plate there. It's called the Move. It's one of their new personal units. We use that. That's a dedicated core stability strengthening position. We do a lot of planks over there. And then as we move over here towards the corner here, we see these 4 pieces of equipment here. These are through our representation of the progression from left to right on the posture rack. And now these are called Exervibe units. These are different vibrational platforms, but this is a whole cage system that allows us to do rehab exercises for the spine, for stability. Some of the exercises we do here do not exist anywhere else but on these machines here. In the corner, we have Be Strong for Life. Be Strong for Life, and this machine right here is called Biodensity. This is about bone health, osteoporosis, osteopenia. We have another video on the website, on the YouTube channel, about osteoporosis and the Biodensity machine. So right now, I'm in the back corner beside the Biodensity machine, looking towards the front door. And as I scan through here, you can see all the different plate pods that we have here for the power plates. And then over to this side, everything is an open concept, so we can keep an eye on everyone at all times. And then you're gonna see the 2 adjusting stations right here. And we're gonna go over there in just a second. And in the background there, right by the back windows there, that's where we do our traction. We're gonna get over there. And these 2 stations right here, we have this one right here and the other one over here. These are our adjustment stations. And even if you look at this table, I have to do a full video on this table because the table is absolutely amazing. Any postural deviation, this table, we can put that person into a position that is going to be comfortable and have the greatest effect. And I have done, this is one of our workstations here. And right here we have the instrument, the IQ impulse adjusting instrument. I have a video on that on our website. And so all the spinal adjustments get taken place with this first table and the second table over here. That's where Dr. Angelica works. So right now I'm standing at my desk, or at my adjustment table here, number 1. And from here, I get to see, there's the front desk over there. I can see the entire office, all equipment, all patients. And as we go over here to the traction area here, and the decompression, which is in the corner here, I'll come back to that in a second. This area is the traction area. We have 4 tables in the center here. On the center table, we can do cervical, thoracic, lumbar tractions. Over on the wall there, the 2 chairs, we had 4 units, but now we've had to restrict them to only 2. And we do cervical traction on the wall there. That's axial traction, 2-way compression traction. And then back over here is our decompression table. And the decompression, there's a video online on the YouTube channel that describes how we use and how the decompression table works. From the traction area, we can see this other area we have here. We call this the butterfly zone, or the butterfly station. And the butterfly station is used for balance, vestibular training, neck injuries, shoulder injuries, and we use a combination of motion guidance with laser beams and also neurofeedback focus unit to train the brain and the anatomy and the nervous system all at the same time. This area is inside the X-ray room, and this is where we will test our posture on this one, on the Be Strong for Life grid system that we developed. And we'll also do posture and squat analysis. The view from the X-ray room is quite good. We have a pond out there. Sometimes there's some big turtles that you can see when the water's calm. We've got a little bit of breeze today from the southwest, bringing in these warmer winds. But this is right here, if you can see this. This panel right here, this panel is the brand new digital. That is the computer right there. That is the sensor computer that takes the x-rays. And I'm going to talk about that in a second. So behind me here I have the computer screen for the x-ray system. And if you come across here, you'll see there's the x-ray unit here in the corner. There's the view from the windows. I'm standing on the posture board, but what I wanted to say with this new x-ray system is absolutely phenomenal. We have, this is our 3rd x-ray system, 3. We went from digital film, we went from plain film, and we switched that out in 2008. And then just this, or about a year ago actually, in May or June of 2020, we switched out to the brand new digital system, high-tech, high definition. And so from plain film to our first digital system reduced the exposure by 2/3. So it was only 1/3 of the exposure, which is pretty cool. Now, the second digital system, this brand new one, the images are up in 15 seconds, and it's 1/10 the exposure of the old digital system. I mean, it's just, the technology continues to improve. It's absolutely amazing. Right now I'm standing in the x-ray room, and as we walk towards the next room here, this is our day 2 room where we go over the report of findings room. We have 4 computer monitors here, 1, 2, 3, 4. And we'll put we'll put all the x-rays and posture and balance scores on for the patient on those monitors. What we have right here, this is an in-body composition computer. So it tells us body fat, hydration level, how much muscle tissue you have. The system that's right over here, this is the balance track system. Right across from the reception area, we have this little room in here, and this is our diagnostic ultrasound room. So we use diagnostic ultrasound to diagnose if someone has a shoulder rotator cuff tear, a meniscal tear, strain and sprain. We also use the ultrasound for guided injections on the other side of the clinic when we're doing PRP, Prolotherapy, or stem cell injections. So here we are now on the other side of the clinic, and this is our assigned Ultimate Medical Group. We have to repair, rebuild, and rebalance. How true is that, right? So this is where we rebuild all the injuries. So this is one of our neurofeedback centers. So we have a video online about neurofeedback and the phototechnology. This is one of the main stations we have. We have a zero gravity chair here that we use for recovery for patients. The first room we have over here on the regenerative side is our procedure room. It's also where we do, this machine right here is shockwave therapy. I have several videos online about the shockwave. In the back there, that big machine looks like a C. That's a C-arm fluoroscopy unit. This is a carbon fiber table right here that we use for our procedures and our medical cart. So when we do procedures, whether it's prolotherapy, PRP, or stem cell therapy, they're all done in this room here. Beside the procedure room, we have another room here which is multi-purpose. This is a prep room for our procedures, but we also have another neurofeedback station in here. Everything is portable, everything is on wheels, so we can really transition every room to what we need it to be. All right, the final room we have in the clinic is the best. This is where all the magic happens. This is our Sterile Lab. So I'm gonna bring you in here and just show you some of the equipment we have here. So the first piece of equipment we have here, this is an autoclave. And autoclave is what we sterilize all the tools with. As we go beside it, we have a centrifuge. And beside that, this is a laminar flow hood, which means on top of here, these are special filters. It's a positive airflow, so the air comes down through the filters and it sterilizes the air inside the chamber here. So all of our injections that we make, whether it's prolotherapy, PRP, platelet-rich plasma, or stem cell therapy, is all done inside this laminar flow hood. Now, as we continue to move in this direction here, I'm going to move the camera up a little bit more so you can see everything. Over my shoulder, right there, that guy, that's a special centrifuge for the stem cells. And obviously here's this laminar flow hood. But right here, this guy here, this yellow computer right here, this is a stem cell counter. Very expensive piece of equipment. But what it does when we're doing a case, before, and I make the injections, I run this lab, I do all the work with the cells on this side. I prepare all the injections over here. And when we use this piece of technology, when I'm ready to make the injections, I put a little bit on, a couple drops on a microscopic slide, and what happens is that it gets fed into that computer system, and the computer is going to calculate how alive those cells are. So out of 100% of all the cells that we're extracting from the patient, and prior to injection, how alive are those cells? And this is going to give us a count. So we call it viability technology. And if 100% is the most we could possibly do, that means that every cell we took out and every cell that we injected, they were all alive, no dead cells. The majority of our cases are 99%, 98% alive, which is very, very excellent. Then it also gives us a count of the volume and how many stem cells per cc we're injecting. So the last case we did happened to be over 20 million stem cells per cc. So if we're injecting a knee, for example, we have 5 cc's inside the knee, which is like a teaspoon. Then there's 100 million stem cells going into that knee. But this lab here, this lab is, when we're in here, this is a very humbling experience, because when I'm working with your cells, the stem cell and the PRP is a gift from you, through us, back to you, to help repair, rebuild, and rebalance your damaged tissues. So this is a fabulous, fabulous, I love when we work over here. All right, so here we are. Hope you enjoyed our tour today. There's a lot. This clinic has evolved. 30 years in practice this year, 30 years. It'll actually be July, 30 years in July. And from where we started to where we are today, we just continue to grow. We continue to push the envelope. I would challenge I would put our clinic against any clinic in the country for a complete rehab of your structure, from the brain work all the way through, all the power plates to the regenerative side. But our rehab is what separates us from everybody else. And when you combine the state-of-the-art regenerative medicine that we do in this clinic here, it has really been an exciting journey that only continues to get exciting. It only continues for us. We want to continue to empower people to live their best day every day. And so we have to have the best. We have to be competitive. We have to be competitive not so much from outside, but really within ourselves, to continue to push ourselves to be the best we possibly can be. Our team is fantastic. Our doctors are fantastic. And we're just so excited about what we do here and the lives we change, the lives we touch. So until next time, turn on your subscriptions, share us with your friends. Have a fantastic day, and God bless. We have lots to share next time. God bless you. Have a great day.